Welcome to today's podcast episode, everyone. I've got a very exciting guest for you guys. For those of you just joining the podcast, we're E.N.G Media, and today I have Bill with me, co-founder and CEO of FetchGoat. So, Bill, I just wanted to tell you, thank you so much for joining us today on the podcast. I'm excited to let our audience know a little bit more about FetchGoat and kind of dive into all the awesome stuff that you guys are working on in the healthcare sector.
Yeah, Tyson, thank you so much for having us. We're honored. We're head down working every day. Being able to take a little break and talk about some of our progress is certainly a welcome relief.
Yeah, absolutely. And so, we said your name already, FetchGo, and I know you guys deal mainly in healthcare logistics. So, would you mind maybe breaking down for myself and the audience a little bit about what your guys' core area of focus really is?
Yeah, happy to. So, unlike a lot of tech companies, we're not a bunch of software engineers from Silicon Valley. We're a bunch
Yeah,
of freight guys that came out of the healthcare logistics space, but we came out of the healthcare logistics space with ideas on how to make it better. And one of the biggest hurdles or biggest things that we saw in the space was healthcare companies, healthcare organizations of all sizes. I'm talking about the biggest ones in the world and even
yeah,
the local smaller community ones. But these folks all have the same issue, and that is they use multiple delivery partners or multiple carriers. It could be FedEx, UPS. It could be a local mom and pop courier. Could be a
gotcha.
big regional or national courier they use. But they use multiple couriers, all over the country and multiple carriers. And so, but what happens is they're forced to manage all of them manually, right?
Oh, wow.
The reason they manage them manually is because each of those courier companies and each of those integrators, the FedEx, they all use different technology. Everybody
Wow.
uses a different dispatch system or TMS. And so for a healthcare organization to integrate with all those providers is never going to happen. They're never going to get the resources or budget to do that. So our idea was to build a system that's actually more or less an interpreter, right? And so with FetchGoat is FetchGoat comes in and lays over the top of all of your delivery providers, and we aggregate all of that information into one single pane of glass. And so they can see everything that's happening from every specimen moving to, every activity, all the stuff, all the supplies that are coming inbound, you name it, they can see all of that in one single pane of glass. Plus we capture it all and measure it using our analytics suite as well that we provide to them.
Oh, wow.
So they've gone from really managing all of their logistics manually
Uh-huh.
to full automation overnight. And it's absolutely game changing for them. Because remember, in healthcare organizations like laboratories, the big labs,
Uh-huh.
the very few of them actually have dedicated logistics folks. It's
Oh, my gosh.
normally when you're dealing with a hospital system, a healthcare lab, that person is also a lab technician. They're
Oh, wow.
they're yeah, so don't focus on dispatching couriers, go focus on saving lives and let FetchGoat manage everything else.
Percent. So a lot of the manual management that is done, that's not even, these healthcare companies, like their team members, it's not even their main job. Is that basically what you're saying?
Yeah, totally, totally. If
Wow.
not, they're doing like the rest of the world, we're doing 3 and 4 jobs, right?
Yeah.
So
100%.
yeah, so if we can give them some automation tools and manage that stuff for them and give them a nice tool to look at and see and review, then yeah, it helps them all the way around. Saves money for the healthcare organization, right? Because now they have visibility of what's actually going on in the
Yeah.
network. It saves money for the couriers
Uh-huh.
because how do they manage them? Well, they manage them manually. So they're calling in for pickups, they're calling in for rate quotes, they're calling in for PODs, they're
Mhm.
calling in for, hey, I need, claims, all that information they're calling or emailing. And so keeping a track record of those activities is basically going through and say, well, I have the emails, but I don't have the recorded phone calls. So
Oh,
there's no
geez.
there's no verification. And so with this, now we bring all of that in one place. Plus, since those phone calls and emails are not going into their carriers anymore,
Uh-huh.
well, then we reduce those phone calls by 67%.
Oh, wow.
Yeah, which makes the courier more efficient too.
100%. So not only are you streamlining that process, but you're kind of, you're freeing them up to have more time to actually do what the more, I guess, the core area of their job really is. And
Yeah,
it's interesting
which
that you
is which is patient care.
patient care, right?
Yep.
100%. That's the
Yeah.
most important thing too. So it's cool to see how you guys fit into that equation. and kind of solve for that as well. And you mentioned that you guys and your team has come from like the healthcare delivery space,
Mhm.
specifically. And so it almost sounds like you needed that domain expertise to be able to be doing what you guys are doing currently as well. It sounds, you simplified it for us, which I appreciate, but I'm sure it's more of a complicated process than it sounds as far as like creating that layer that looks over all of the different carriers. Could you maybe speak a little bit more to like the talent that you have on your team and like where you guys like what exact area that you guys came from and how it's helped you build out, FetchGo to be able to serve these healthcare companies?
Yeah, my co-founders and I, we came from the logistics space. We all worked together in a previous life,
Oh, wow.
and yeah, so we came from the healthcare logistics space, and then there's only one of us that's the technical guy.
Oh, wow.
So he's a software engineer that we worked with in a previous life. Really bright, but it was important for him to come along because he understood how the difference in the service types that the couriers have and the carriers have. So
No.
he knows the difference in LTL. He knows the difference in a courier having routed delivery or scheduled and routed delivery versus a stat or on demand order. But he understands all that. And so he's able to build the application around, those difference in the nuances of the services that all the transportation companies provide.
So, yeah, no, and
Mhm.
that is awesome. I bet he's tasked with a lot on the technical side of things, specifically.
Yeah, we jokingly we well, not jokingly, we're serious about it, but, we call him Oz, the great and powerful Oz, because he makes everything happen,
Oh, wow.
and he's definitely the guy behind the FetchGoat curtain
Yeah.
that makes it all happen, and he's got an amazing team that we work with. We're truly blessed to have, the folks on board that we do, and again, we all come from the space, from the logistics space, so,
How awesome.
yeah, it's pretty cool.
Yeah, no, you guys are crushing it, and I know that you guys, from what it sounds like you started from, an idea to now I know you mentioned before the podcast, you guys have scaled to upwards of working in over 45 countries,
Mhm.
specifically as well, so I know that that's probably a huge task as well, but could you maybe speak to what sped up FetchGoat's, user adoption from the companies that you're working for? Because our audience, from our podcast are technical based founders and in software and technology companies, and I'm sure they would love to know, how you were able to spread adoption really that fast. And it sounds like it's through the awesome technology and through what you guys are building out.
I would say 2 things really drive that. Number 1, we were fortunate enough to have a lot of amazing relationships while we were logistics providers, right?
Oh,
So
nice.
some of these healthcare organizations that we're dealing with, and we're talking about some global healthcare organizations, but these folks were customers of ours when we were delivery providers, and so we sat down and told them what we were gonna build, what we were actually at the time, we were actually in the process of building it, and so when we told them that, they were like, "Heck yeah, sign us up. We would love to have that." And so that kind of accelerated our building, to have them excited about it, and then when we launched, they came and supported us right away. But
Oh, wow.
not only did they support us, but we supported them because we gave them tools that they really, really could use,
Yeah.
and so that actually helped. And then, the second part of that is we had kind of I'll say a strategic move, but we chose not to charge a seat license.
Mm,
And because someone in healthcare leaves and goes to work at a different organization, they're not gonna go into the body shop business. They're gonna go into another healthcare organization because that's where their experience is. And
yeah.
so it's already happened with us. We get a phone call from a person that used to work at one of the labs that we support.
Mm,
And she left and went to a large healthcare organization and got there and goes, "You guys aren't using FetchGoat? Why not?" And
nice.
so we got a phone call and we ran a demo and literally had a signed contract within 2 weeks.
Wow, that is awesome. I love that strategic move as well. I would say that that's how I would label it as well. And this whole concept, I guess, of healthcare delivery and tracking it's kind of new to me. Coming from I'm
Mhm.
talking to software and technology founders specifically, and also more folks in healthcare technology now. But could you maybe speak to where the state of healthcare delivery tracking is before as you guys are building out FetchGo? I guess what like is it kind of like an archaic process right now, or was there already a lot of technology that was, making things more efficient? Or I guess where is the healthcare delivery system kind of at?
So they're still in the dark ages. The vast majority, not all,
Mhm.
The vast majority, though, are still in the dark ages because they're still managing the process manually. And so when you manage a process manually, then you're not generating data, not digitizing your process.
Yeah.
And so that's what we do is we come in and we digitize it. And so, but once they are acclimated and once they get on board, then it's, hey, can we do this, or we have an idea to expand into some other part of the company.
Mhm.
But yeah, I think for the most part, the vast majority of them now are still operating manually, which is good for us as we continue to grow.
Yeah. I think, when we chatted before as well, you mentioned that, we're at the point now, especially in the US to where you can track the delivery of a pizza, but sometimes you
Right.
can't track the delivery of an organ. And really when you said that, it really stood out to me. And, it did just speaks to you mentioning, the majority of the healthcare delivery tracking space kind of being in the dark ages, so
Yeah, no, and that's true. That's true. I mean, you can track a pizza and know what process it's going through right now. It's in the oven. It's out of the oven. It's being prepped. It's on the way. It's 6
yeah.
minutes away, right? But you can't do that with an organ for transplant.
Oh my God.
There's some great companies now, and a lot of those next flight out providers like the airspaces of the world and the
Mhm.
former M&X of the world, they got a lot better with technology. But the vast majority of them are still tracked manually, and you got a call center full of people that's calling,
Yeah.
each provider, and then that provider may or may not be connected to the driver. So then that provider has to reach out for that driver and find out where they are, what the ETA is. And, so the answer in this space on logistics is the driver's always 10 minutes out. So
Oh,
then they
wow.
come back and said, oh yeah, the driver's 10 minutes out, whether he or she is or not. And so we can give them real time information and a breadcrumb of where the driver's been.
100%. It's so intriguing to me too to hear kind of how that process in general is kind of broken for, most organizations. From my perspective, I think that as you mentioned, like handling the logistics side of things for these healthcare
Mhm.
companies, it's not essentially their main job. So maybe that's why. But I'm hoping that these companies are able to actually see the ROI between managing and measuring deliveries as well. Obviously, I could totally see how being able to track and measure like where somebody's organ is at can lead to better patient outcomes for these healthcare organizations. But could you maybe speak to what it does from like a cost savings or, a trust perspective for some of the organizations that you're working with?
Yeah, that's the biggest thing, right? You have to deliver ROI. If not, it's just it's an expensive tracking tool, and we're not expensive by any stretch, but it just becomes an expensive tracking tool. And so how we deliver ROI is there's a lot of different areas in technology, or excuse me, in delivery in the healthcare space that the couriers and carriers charge for. Okay, so they charge for every stop that they make if there's a stop charge, and if they're paid by the route, then there's always needs to be optimization that happens with the route, but they're paid typically by the stop. So now, and that could be a contract courier or even an in-house courier. And then, so if they make a stop at a clinic and that
Uh-huh.
clinic is closed this week for the doctors because the doctor's on vacation and the staff is on vacation, well, then, what's to say they're not going to stop there 5 days a week, right? And
Right.
charge the healthcare provider a stop charge for 5 days, and then but they know good and well they're closed, right? So there's just no incentive to do that. Or there could be a different driver that comes on, the rest of the week, and
Mhm.
then that driver is not aware, so they're going to stop there that week. So what our system does is as soon as they make that stop and it shows 0 specimen to pick
Uh-huh.
up, we immediately flag that stop. We report it to the healthcare provider, and the
Oh, wow.
healthcare provider at that point can reach out for that particular clinic and find out when they're going to be open back up. So if they're going to be closed all week, then we block that stop in our system. We push that back upstream and we block that stop. Tell the delivery provider, do not make the stop for the rest of the week. Please
Oh, wow.
resume on Monday. And so in one instance, we saved one of our large labs that we do business with
Mhm.
just by getting control of those, what we call non-productive stops, um,
Wow.
or or dry runs or 0 specimen stops.
Mhm.
Just by getting control of those, we saved them $10.5 million last year.
Oh, wow. I mean, that is huge. That is
Yeah,
aw that's
it's
real
big.
impact.
Yeah, and it's real money that they realize right away.
Oh my
So, and the other thing is if you have another area, and there's many areas, but another area is with your in-house driver. So you have in-house couriers. They have no technology. They're literally I could tell you stories about, one of the largest healthcare systems. Everybody knows the name of this place in the country, but they still dispatch their drivers from a spreadsheet and paper. They have a paper manifest. So they go and make their stops. They're writing down the information on the stops. And all you have to do from a validation standpoint to verify that is you have to take the data from the paper and move that paper into a spreadsheet, right? And how do you know if that paper's right? How do you know the times are right?
Right.
And the drivers also get paid for wait time, right? So how do you know they were actually there? You
Right.
don't. You're just taking their drive. It's you're taking their word for it, and
Yeah.
not saying that they would do that,
Sure.
to do the company wrong, but there may be one or a few of them out there that do.
Yeah.
So we take that manual process and we digitize it. We give them that so they can now we know exactly where the driver is, exactly how long they waited. Were they at that location when they waited? So, but if
100%.
not, then we can look at that in our system. We have a proprietary AI that works behind the scenes and is all looking at data and looking at weather and
Oh, wow.
delays and traffic. And but he's also his name's Geronimo is our
All
AI.
right.
So
I love that.
Geronimo is also looking at route optimization too. And so if they say if Geronimo sees something that doesn't jive or he sees a couple of zero specimen stops, Geronimo sends a red flag. So
Oh, wow.
yeah, so we got several stop checks that are looking at that. Yeah, savings come pretty much right away.
Yeah, I mean, it's intriguing to me too to hear how much like these companies and these clinics and labs are actually able to save by you guys managing the
Mhm.
carriers that they're using as well. And I appreciate you sharing some insight into how you're leveraging like proprietary AI with the name, Geronimo to look into carriers a little bit more closely and help, these companies save from that perspective as well. Are you guys doing anything else with Geronimo, the proprietary AI outside of just the carrier aspect side of things?
Oh yeah, yeah. So AI is doing a couple of different things. Obviously, analytics. We're
Yeah,
looking at a lot of big data. We're getting some amazing amounts of data for every single delivery. One of our
nice.
customers, they have about 260,000 a day, and so it's massive, just massive scale, and that's globally.
Oh, wow.
And so we have our own weather repository. We lay AI over the top of that weather repository. And let's say I'm located in the Dallas Fort Worth area. We had a big rainstorm that came in this morning,
Wow.
and so I mean we had some real heavy rains coming in. So when you have flood warnings or could be a blizzard warning or highway shutdown or whatever it might be, Geronimo's aware of it,
Wow.
and so Geronimo can see it in our weather, and so when an area goes under weather warning,
Mm,
then Geronimo can send each of those clinics or the company send them a notification that, hey Tyson, be aware that the DFW area is having weather today. You please expect delays.
oh, wow.
So yeah, I think our customers appreciate that because there's one thing to have technology, but having technology that understands where you are,
Yeah.
I think is amazing. So Geronimo's looking at weather patterns, looking at traffic delays all over the place. Geronimo never sleeps.
I love it. That's one of the benefits of AI, right? Like I love that aspect of it as well. And for me, it sounds like any clinic or lab that might hear about FetchGo, it's almost a no-brainer for them to look to work with you guys. I'd be curious to know, is there anybody or any companies doing something similar to what you're doing for the healthcare delivery space?
There's a few small ones out there. We're seeing a couple pop up here and there, but they're 100% focused on one avenue of it.
Gotcha.
So like with us, we're more of an enterprise solution.
Yeah.
So when a hospital system plugs us in, it normally happens like this. We're first plugged into the lab, right? Because that's where a lot of the volume is. And then the pharmacy catches wind that
Mhm.
that we're there and they see the technology. And so the pharmacy wants on board as well. And then after the pharmacy wants on board, then supply chain comes in because they want to track their in-house drivers and find out, where the desk and boxes are being delivered. So they want access to it too. Yeah. So we're able to digitize them and get them up and running very, very quickly.
Yeah, no, that is awesome. I mean, with you guys being in 45 countries and kind of handling a lot of volume from what it sounds like from the type of, the caliber of clients that you guys have, I think it's interesting to see everything that you guys are going to continue to do in the healthcare delivery space. It sounds like, you're kind of providing more of a holistic solution just from everything that we've covered so far. And so that kind of leads me to my next question. Like, does FetchGo have any specific like new initiatives that you guys are looking to roll out with your technology? Or maybe is there anything that you want your customers to know about that you plan on executing in the next maybe 6 to 12 months?
Yes, and sooner than that.
Oh wow.
So, yeah, so we have a very, very aggressive team from, from a development standpoint. All of our development is done in-house. So we have a data center in Alpharetta, Georgia, which is just north of Atlanta,
Oh
is
nice.
where my CTO and his team of developers are there. We have a few remote developers that are here in the US, but primarily everyone is here. So they work very, very quickly. Also, with the help of AI, we can also accelerate development very, very quickly. And so in doing so, we really want to focus on that patient piece of it. So on the patient care and that information, like one of the biggest trends that we're seeing today is that direct delivery to patient, right? So you have surgery, you go home, and
Uh-huh.
then here comes all of the equipment that you're going to need in your recovery. So it could be oxygen, could be medication, could be, all kinds of different, all kinds of different systems. And so what we're training right now, Geronimo on that is to be able to give the customer proactive notifications. And we're doing some of it now today, but
Uh-huh.
we want to do it with much more precision and accuracy. And so what'll happen is if the driver leaves my house and he's heading for your house,
Uh-huh.
then when he's exactly ten minutes out or 10 miles out, he'll send a text to that point of contact at the patient house. Could be a nurse, could be, the patient themselves, to let them know that the driver's en route and they're
Oh,
10
nice.
minutes out, and to be please expect delivery because they're post surgery, right? So they may need a little extra time getting to the front door,
Yeah.
and so to accept that delivery. So we're working on training Geronimo for that, and then we have a couple of others. I'll get slapped around on my next roadmap meeting. I'll bring them up, but it's
Yeah.
really good. But it's all revolved around patient care, improving patient care, and that information.
Yeah. How awesome.
And
This is why I really appreciate people like you, Bill, who come on our podcast and you talk about the impact that you're creating with, the solutions you're bringing to the market with your guys' technology and with everything that you're doing in the healthcare delivery space. A big reason why we have this podcast is because we want to show that, proprietary AI and companies that are leveraging AI, like it's not just a buzzword, there's actual real impact. And it's so intriguing to me. And really, some of our best guests have come from the specific domain that they're providing the AI solutions for. So it sounds like your background and your team's background, both in the technology, but then in the healthcare delivery side of things, has really amplified like the impact that you've been able to make, in the last 5 years with FetchGoat. So I know I'll definitely be following along everything that you guys are doing on your website. But really, outside of the website for FetchGo, what would you say is the best social media platform, maybe for these healthcare companies or anybody that might want to connect with you? Like, is there a specific platform you prefer people go and connect?
yeah, LinkedIn. LinkedIn is head and shoulders above for the professionals and business professionals. So yeah, so LinkedIn, we have we're active on LinkedIn daily, and
Nice.
so we're not hard to find. Plus, with a name like FetchGoat,
Yeah.
it's not hard to find either. So yeah, we spend a lot of time on LinkedIn with our healthcare customers.
100%. Yeah, and I love the goats in the background as well. For anybody that didn't notice, I don't know how you could have missed it, but they've got the logo in the background, so I love that as well. But yeah, I think that hopefully, for anybody in the healthcare technology space that watches this, if they have any questions, definitely feel free to maybe reach out to Bill or myself, even comment on the video, and maybe we can bring Bill back on for a second to maybe as like a Q and A if you're open to it, Bill. I know I kind of put you on the spot, but that would be
Always, I love it.
awesome, guys. And I'll be sure to include links as well in the description of our
Mhm.
video to your guys' LinkedIn, the website, all of that good stuff. I highly recommend that you guys do go check out FetchGoat and all of the awesome stuff that they're working on. But really, other than that, I just wanted to thank you again, Bill, for coming on and sharing your insights and really for your time today as well.
You're very welcome, Tyson, and I very much appreciate what you do. Do a great
Absolutely.
job, and we're honored to be here. Thank you.
Awesome. I really appreciate that, guys. Well, like I said, if you have any questions, feel free to comment on the video. And really, other than that, we will catch you guys in the next video.